This episode of AMSAtv focuses on health and wellbeing, which is becoming an increasingly big issue for both medical students and doctors alike. Let's take a look at the problem and what AMSA is doing for you.
Studies have shown that 24% of first and second year medical students are depressed, and of these, 1 in 4 have suicidal ideation. Furthermore, only 1 in 5 of these depressed medical students actually seek mental health services. Recently, an article published by Dr. James Hillis and colleagues in the Medical Journal of Australia reported the studies of an AMSA health and wellbeing survey of 1,328 medical students. Over half of the respondents reported that they had a stigma associated with mental stress, and 1 in 4 said that they were uncomfortable accessing mental health services. Approximately 70% of those surveyed said that they had a relationship with their general practitioner, but this figure fell to 45% for international medical students.
The problem of health and well-being affects doctors as well. Doctors have poorer mental well-being and experience greater rates of stress and depression than their population counterparts. Perhaps most worryingly, doctors are more likely to commit suicide than their matched peers.
I spoke to Associate Professor Michael Baigent, who is a clinical advisor for Beyond Blue, about how to identify mental health issues and ways to address these.
We talk about physician heal thyself, but it's very, very hard to make the diagnosis in yourself of depression, or for that matter of an anxiety disorder. So what I suggest to people they look out for if they're looking for signs of depression are a change in their functioning. Essentially, when people get depressed, they don't function as well as they used to. If you're worried that you're depressed, it can be helpful to look up the Beyond Blue website. I mean, as medical students and doctors, we often think we know it all, but it doesn't hurt to be refreshed about what the symptoms and features are of the disorder and to check it out in relation to yourself. But if you're worried about it and you think maybe you have got it, well then it's a time to go and see somebody and get assessed yourself. The best person to do that in the first instance is a general practitioner.
The Healthy Body, Healthy Mind initiative, run in conjunction with MDA National, encourages students to run their own wellbeing events.
AMSA has also developed a Get a GP campaign. This campaign involves recruiting GPs who are willing to bulk bill medical students. We strongly encourage students to build a relationship with their GP early in their medical studies. Visit the Get a GP campaign under the project section of the AMSA website.
In collaboration with the Australian Medical Association and Beyond Blue, AMSA this year are producing a wellbeing guide. This will provide an excellent resource for available support and services.
To find out more, please visit us at amsa.org.au or contact your local AMSA rep.